You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in just a few appointments. With us, we have Idaho's dental implant dentist. With us, we have Dr. Hall and Dr. Roberts. Welcome to the program.
Hey, great to be here.
Now, you've both been on the program before. I think it was like 6 years ago.
Yeah,
it's been that
I think
long,
you guys are getting younger. You look better today than you did back then. But for people that don't know you, I guess you do all the same things, and you do most of kind of like this all under one roof philosophy. Is that right? You're up. So who's a typical patient? What are the different procedures you do? I mean, I looked at your website, and it was just a real long list of things you do. So,
you know, Randy, I don't know if we have a typical patient. We see kids, we see their parents, we see their grandparents.
Okay.
We pretty much do everything that dentistry has to offer procedure-wise.
So from the most basic to, you know, the dental implant patient, what do you do? Like what?
From fillings to bleaching to root canals, crowns,
crooked
dentures.
teeth, Invisalign.
Invisalign? You do a lot of that, by the way?
Oh, we do. Yeah, quite a bit.
Yeah.
Okay.
The Invisalign's big. People love not having to have the brackets on their teeth, having those clear, removable, straightening teeth. It's a big deal. You know, it's mostly with adults. The kids, we still like to see them in the metal braces. But yeah, Invisalign's big with our patients.
Okay. Now, one of the things we talked on the telephone, since last time, you have a CT scan right in your office. I guess normally you send people out to an imaging center, but you have it right there.
We do.
How are you using it? Because you said it's a big change for you. Made your life easier.
Yeah. You know, the implant portion of our practice has been changed by the CT scan because it allows us to place implants safer. It allows us to place it in better bone. It tells us what kind of bone the patient has. We're getting, we can just give better results.
Okay.
Well, let me give you an example, Randy. I had a lady come in about 2 months ago, and she had been at another office having dental implants done, and she decided to have sedation done, and so she had her sedation done. She's asleep. The dentist went in and flapped her tissue, so they cut her gums open and exposed the bone. During this procedure, he thought that there wasn't enough bone left, and so he just sutured her back up, and she woke up, and he told her, hey, we weren't able to put the dental implants in.
Okay.
And so anyway, luckily, she found our office. She came in, and we sat down with her, talked to her a little bit, and we decided to take a CT scan. We put her through the CT scan, and we found out, hey, she does have enough bone. And so we were able to...
So there's no way you would know that without that?
The CT scan is accurate to within 1/10 of a millimeter.
And it's fast.
Oh, yeah.
I mean, I just had one done, by the way.
It's in our
I don't like
office.
putting stuff in my mouth. I mean, you're there, and boom, it's over.
20,
If we
30
make
seconds.
a decision to take it that day, no problem. The patient goes in, takes it, and...
So people that were not candidates before for dental implants, not enough bone, etc., are now candidates today in your office.
Absolutely, because we're able to place implants where we weren't sure if there's bone or not, because the bone's entry, you have a sinus in this area, you have nerves, you have blood vessels.
And the neat thing too, Randy, is that we can actually place these implants before we do the surgery.
Virtually.
We can virtually put them in on a
computer
computer screen.
Is that right?
Yeah. And so we'll sit down together, we'll have a patient, we'll take a CT scan, and we go into a room and we sit down and we plan the case together. We do the surgery virtually before the patient ever shows up for their appointment.
So I have a lot of questions about dental implants, but a little bit more about you guys, your background, your training, and how long have you worked together?
Sure. We've worked together the last 18 years.
How'd you meet? How'd you guys meet?
We met back in dental school, and we played on the same hockey team. That's how we got.
You guys played hockey together?
We did, yeah.
Who was the better hockey player? He was, really? I would have never guessed that for some strange reason.
Yeah. We had a team. We lived in San Francisco. We put together a dental team actually, and we played the other teams in the city.
Is that right? So the dentist against everybody else?
The city, yeah.
How'd that work?
We were drumming up business, trying to knock out some teeth.
Okay, so let's talk about dental implants for just a moment. Okay, so let's begin with the different categories of dental implant patients you see, from the one tooth on up.
Sure, you know, one category is the single tooth implant patient. I mean, that's a great, the implant is a great solution for that patient, because if they have really healthy teeth on either side, you don't have to cut those teeth down to fill in that space. So an implant for single tooth, but it's the patients that are missing 2 or 3 teeth. Maybe they have a partial denture. Maybe they have a partial denture and that's by the way, Randy, that's something that comes in and out of the mouth. That's a removable appliance. It's like a denture, but you still have some teeth. We can pin those down with implants so they become much more stable.
And the other thing, Randy, with those partial dentures, they're only really made to last, 7, 8, 10 years.
Okay.
When we put those dental implants in, we can actually really snug them up into the jaw, and they don't put the pressure on the adjacent teeth like the traditional partial did, and so they're lasting way longer, years and years.
Well, and
with
it
those.
might not be the partial that fails, but the teeth that are holding the partial, because a normal traditional partial denture, it holds on to the teeth. So if you have a tooth and the partial grabs onto it, and then you chew on the partial's moving and it's working that tooth. It's like having, if you want to get a fence post out of the ground, you work that fence post.
All right.
And so they wear this partial for 5 years and their tooth fails. Not
So
the
it
partial,
messes
the
up
tooth fails.
the other
Messes
teeth
up the
around
teeth,
it.
yeah. So with the
Interesting.
implants, that partial actually now locks in the implants. So now our support's on the implant, not on the teeth. So we're not rocking the tooth.
Okay.
And we're
And it's more stable than the tooth.
In the long run, do you think it's less expensive to get, like if you're missing one tooth, right? Just go in and get a dental implant rather than something that may only last 10 years.
long term, I would say for sure. Yes.
Okay. Okay.
Well, and there's so many other benefits. That's a tough answer to give because now you're talking about bone loss and you're talking about the strain on the other teeth, overloading the other teeth. The implant supports and it gives strength back to the whole system. And so there's unforeseen costs that would come in down the road.
Do you think the future of dentistry might be where if you're missing any teeth, you just get dental implants? Whether that's 50 years or 100 years or whatever? Do you think that's the future?
Well,
I mean, is that in a perfect world? Does everybody
world,
get?
absolutely.
Everybody gets a dental implant if they're missing a tooth.
I think the standard of care should be an absolute bare minimum of 2 implants underneath a full denture. I mean, that should be the standard. The definition of a standard of care would be something that, as a doctor, we have to do.
So when we
have
say
to
no
reach the
more
standard of care.
dentures, that's not an exaggeration.
Well, that might be unrealistic,
But I mean, that's the future. I mean, if it were up to you two guys, if it were up to you two,
I
for
say
sure.
definitely that's where we're going.
like
I mean,
no more
yeah,
dentures.
no more dentures.
I mean,
would
traditional
be-
dentures as we know them. Right?
yeah.
So you say that in Idaho, there's got to be tens of thousands of people with an upper lower denture. You say,
Sure.
It could be, yeah.
and so so the categories then of dental implant patients, the denture wearers, what are they?
Well, basically, two. We have the person that's been wearing a denture for years and years, and they come in and they want something more permanent. And then we have the person that's about to lose their teeth, and that they come in and we got to decide, hey, do you want to go to a denture or do you want to have something that's supported by implants? And we can maintain if we are able to support it with implants, we can maintain their bone. And give them a more youthful appearance.
Well, and there's a lot of people that don't even know what their options are. They have complicated cases where they have maybe a lot of pain or they have lost a few teeth. Maybe they're worried about losing some other teeth. They have periodontal issues. Their teeth, maybe they have loose teeth. We might even we'll do cultures on these patients and figure out exactly what their bacteria is, find out what's going to be the best treatment to get the periodontal under control. We get the teeth healthy, and then we start replacing what's necessary. Sometimes we can't save the tooth, and then we talk about, is that a spot for an implant?
Okay.
If they're missing.
And Randy, a lot of times too, the denture wearer has been wearing dentures for years and years, and the only time that they actually come to the dentist is to get it relined, and maybe that's every 5 years, and they don't know what's out there.
They don't get told their options either. They come in for a reline, and typically they're going to get a reline. The dentist doesn't even let them know that there's another option.
Yeah. Okay. So your take on it? So if it's as good as you say it is, right? Why aren't all the denture wearers doing it? And you're saying because they don't go to the dentist anymore. I think that's a very good point.
Yeah, I would say that's one main reason. There's a lot of reasons.
What's the other? I mean, what are the fears with these denture wearers?
I would say cost is an inhibitive factor for people coming into the dentist and thinking implants. But when you really look at it, you don't have to say, hey, there's an implant for every tooth. I got to put an implant in for every tooth.
It's a common misconception.
Yeah,
But to get a full arch of teeth, I mean, all your teeth, let's say on the bottom, how many implants?
I would say the minimal would be just putting in 2 implants right in the corners of their mouth, here and here.
2 implants on a lower denture wearer is going to change their life.
Really? They could eat and chew with that?
Yeah.
Oh, yeah.
Yeah, that's going to take a denture that's moves and is sore. It leaves sore in their mouths. They have to be careful with, and it holds it in the mouth. It locks it in.
You do a lot of those?
We
With
do
2
a
implants?
lot of those, yeah.
That may even be the most common.
Okay, so cost, that keeps them from doing it. They count their teeth. All right. What's another thing that holds a denture wearer back from doing this?
The pain is going to be one. I mean, people talk about that all the
It
time.
does seem painful, though.
Well, it's not what you would think. The bone actually doesn't have the nerves in it that the bone's not we call it innervated. So there's not those nerve endings in there. So it's a little bit like having your nails done once you get into the bones.
Okay.
The bone's not bad.
And a lot of times we don't even have to flap the tissue back or take a scalpel out to peel the tissue away. We can just put the implant right through the tissue, so there's not a lot of tissue trauma either.
Because of the CT scan. Because we have the CT scan, we can do what's called a guided surgery.
And yeah, I can show you this
Let's take a look.
right now. This is a surgical stent right here, and this is what we were talking about earlier, how we virtually plan.
Hold that up a little bit, like right here at your sternum. Okay, so tilt that a little bit for me. Let me see. So what am I looking at?
So this would be a surgical stent, and what it is it's we got this off the CT scan. So like we talked about earlier, where we were virtually placing the implants on the computer, once we do that, we send that information into a company, and they mill us out the surgical stent. And so this exactly fits into the patient's mouth, and then we put the implants through those holes.
And so now there's like what, less trauma to the gums.
Exactly.
And because of that, less pain.
Exactly.
Absolutely, yeah.
And the implants are exactly where we put them in on the computer.
So it costs too much, it's too painful, and they don't feel pain during the procedure, right?
Oh no, they're not.
I mean, because it does seem painful. I mean, after the procedure, are there ever patients that go, that didn't hurt at all?
Absolutely. Yeah, in fact,
really?
I'll call patients the night after surgery, and I recently called a fellow that I put in 6 implants for full upper arch the night of surgery, and we give them, of course we give them some pain pills, but typically what we do is we tell them to take just the Advil, and that's usually all they end up taking, especially if we're using the flapless CT guided surgery like this one was. And I get his wife, and I say, how's Harold doing? And she said, I have to go ask him. He's out in the garage. He's under his tractor. He's changing the oil. So,
Only in Idaho.
And that's
the night of that.
And that's not uncommon. It's not strange at all for them to be out doing something the night of their implant.
I had a patient that I just called the other night after doing a 2 implant down on the lower arch. Called her up, and she was a high fever patient, and she didn't take any rear pain medication. We managed it all with some Aleve.
They'll come in after for their next appointment, and we'll offer them the pain pills again, and they'll say, I still have all the ones you gave me last time. They haven't taken any.
So pain is not something to worry about. It's not something, I mean, obviously, I guess we want to put disclaimers, results, vary from patient to patient, but pain is not a big, should not keep you from doing this.
That shouldn't keep you from doing it.
The reputation from the pain is from people who typically have a large abscess, a lot of infection. They're already in big trouble, and our job is to get them healthy again.
Okay.
Those are the patients, that's where the stories come from. When you hear people say, oh, root canal is so painful, it's because they've come in with a lot of infection.
Too late.
Too late. We're solving a problem. Things have already gone bad. So when we're doing dental implants, we're doing it from a position of health. So
like a denture wear that's just gums coming in.
There's no
gums are healthy
periodontal
for the most
disease,
part?
there's
Okay.
no infection. That's been taken care of. We deal with that first. So it's a healthy environment. And so there's not a lot of swelling, and there's not a lot of trauma.
And Dr. Hall, one of the things you were telling me over there in the green room is that they always say, I should have done this years ago. Is that right?
People tell me that all the time. You're never too old to have dental implants. Actually, I had a lady 4 or 5 months ago that she was tired of her partial denture. It was supporting her front teeth. We put 2 implants in her upper arch, and we made her a fixed bridge up there. So now she has 4 porcelain teeth up there that look really natural, very cosmetic. Now she doesn't have to take anything in and out of her mouth. And she was 92 years old, and she loves
92? Why would a 92-year-old want to do this?
Because they want to be better off. They do it for the same reason that the young patients do. They have the same motivation.
They want to eat, they want to chew.
And she said she wished she'd done it years ago. But she finally decided to get it done at 92.
We have our reasons as dentists, as doctors, we have reasons why we think people should have implants, and they aren't always in line with why the patient wants it. We look at it from a health perspective. And so we see somebody with dentures, and they're going to be eating more refined foods. They're going to increase their digestive problems. They're going to, in fact, 40% denture wearers increase their digestive drugs by 40%.
Interesting.
Their inflammation in their system goes higher. They have a much higher chance of diabetes. So these patients come in, and we're looking from a health perspective.
Because they can't eat fiber foods or broccoli or whatever.
Sure.
Right?
Yeah.
Interesting.
Yeah. But they want to look better. They want to have a better social life.
Yeah, they want to be able to smile. They want to be able to laugh. They want to be able
Can they look cosmetic, by the way? Because I told you guys, I said, I feel like I could spot dentures walking down the street.
Sure. Well, it's a major part of what we do is going to be, we're thinking about the cosmetics. There's a lot of little things that we look at in a smile. We want to know we're analyzing the smile line. Where do we put those front teeth? How does it look in the buccal quarters? Does the smile develop? There's things that we think about that the patient...
So they look like real teeth.
We want them to look natural.
It's just like any other cosmetic case. If you had all your teeth and you're coming in to have veneers done, we're doing the same exact thing with their dental implant prosthetic.
Okay.
We're making sure those teeth are where they should be, the proportions are right, and that it looks natural.
Okay. Why do you like it so much, by the way?
I think it's because it changes people's lives. We used to do, before we did a lot of the implants, we really focused on the cosmetics. So we started from a cosmetic point of view, doing the veneers and studying that, and we taught that as well. And we felt like we changed people's lives. We heard it all the time. You know, we'd hear that we had the stories with the tears or the hugs or or that kind of thing.
But I think really when you give somebody the ability to, when they come in and they're wearing an ill-fitting denture that they've been wearing for years and years, and you allow them to have something that actually locks into their mouth,
they can chew,
they're like their natural teeth. They don't have to worry about going out in public and, let's say, having a luncheon with your girlfriends. You don't have to worry about your denture coming out or food getting caught underneath it or having to run to the bathroom and clean it out.
Or even yelling at your kids. I had a patient the other day who, you know, we often say, you know, we want to be able to laugh. Well, this patient told me she wanted to be able to yell. She got mad at her kids, and she's yelling at her kids, and her teeth came out, and then her kids started laughing at her, so she couldn't even yell at her kids. So yeah, it's definitely this changes people's lives.
So it's the happiest group of patients.
It is. It's the most changed group of patients because these people, they have real problems. They're really they're shouldering a lot. They're dealing with stuff we don't think about.
We wouldn't even think about. Yeah.
And they've been in pain for a long time. I mean, they don't just magically go into dentures one day. They fought for years and years and years before they ended up in dentures. They've been in pain. They lost a tooth at a time often, a toothache at a time, 30 toothaches before they're in.
So this is one of the reasons, another reason why the denture wearers aren't doing this, because they don't want to go to the dentist anymore.
They're scared to death of us. Yeah. Which
because they went through a lot. This is interesting. This is good.
We do also offer sedation, and sedation's a great way to get these really dental phobic or fearful patients to have these procedures done and done comfortably. And to tell you the truth, Randy, they don't really even remember being in our office. The medications that we use have a great amnesic effect. They don't remember being there.
They start actually we're changing personalities. You were telling me coming down here about a patient that you had, Kevin, about she was hunched over. She wouldn't talk. She had one assistant in the office.
First visit in, would only talk to one assistant and myself. We did a trial sedation on her just to see how she would do, because that's what she wanted to do. The next time we had her in, we did the full sedation, did her whole case under sedation. And that next time she walked into the office, she was talking to her front desk. She was laughing. She was talking to every assistant in there. And she was just a different person. It was amazing.
Being in the office.
So you take people that haven't smiled in years because they don't like their denture, the look of it. And now you give them kind of a cosmetic look. Mm-hmm. And now they're smiling.
And they're at ease after being, you know, they're so stressed out to start with. And they learn to relax, and they have to relearn how to smile. A lot of people tell me that they purposely hold their lip down and they smile, and they change the way, or they don't smile, or it's real common like this. And we even get this in the operatory. They're talking to their dentist and they're doing this, and I'm like, it's okay. This is what we do. You don't have to hide your smile from me. In fact, I'd like if you didn't do that, because I want to analyze it. I want to see what's going on.
Brand, if you're not able to smile, that's a big deal.
Because I take it for granted.
Yeah, it's a huge deal. Just
you see people, you think they're mad or grumpy or whatever, and you say they might be hiding something.
Can be the most friendly.
They're just in pain.
Yeah. Now I know you brought some models and you brought some photos, so we're gonna have to go to those because we're short on time here. Mm-hmm. So what'd you bring? What do you have for us?
Randy, you have to see this picture because, and I was gonna actually show this for a different reason. Here's a picture where this is the day of surgery. Okay. And that's the first picture we took right as we set her up in the chair.
That's a mirror in her hand.
And we hand her a mirror and she's looking at it. She hadn't had teeth, and now she's got her new teeth. But
so this is a denture wear?
This is well, so not anymore. Now she's wearing.
That's young. Are there people that young in dentures?
Unfortunately, yeah, we do.
And if you notice, Randy, look at her teeth. Look at her front teeth are just a little bit longer. We paid attention to that, and her smiles. She has a really nice full smile.
Is it emotional for them?
Oh, it's very emotional, yeah. And so with this patient, I call her a couple of weeks later. This is actually a patient that I flew out, and we did this case in Kentucky. And so I was keeping track of her on the phone. And I called her back just to see how she's doing a few weeks later. But it wasn't even specifics about her teeth that she was most excited about. What she told me on the phone is she said, John, because we became friends through the process, and the thing she wanted to tell me was that she had started dating again.
Wow.
Yeah, so I thought that was really fun. I thought that was good.
Hey, John, can you hand me those photos? I just want to show Randy this next case of ours that... Okay, this is a photo of a husband and wife. We did the husband was a denture wearer. He was wearing upper and lower dentures, and we went in and put some implants in, and now he has implant-supported dentures.
Okay.
And what's neat about that photo, Randy, is that the wife is actually really smiling. She was really happy that her husband went through that because he's been through a lot, wearing the dentures. He's had constant soreness, not smiling, not able to eat the things that she eats, and it's kind of changed their life together.
Good. Yeah. And they tell you this. I mean, they kind of spill their guts in the...
We hear stories, the denture tours, they like to tell us stories, and people lose their dentures. They take them out at night, and so we've had stories about, their dogs take them, and they have to find where their dogs.
We had a guy on a fishing trip in Alaska that got seasick and lost his dentures and went through the rest of his vacation without teeth.
Wow.
Threw them overboard.
Now, by the way, are they ever without teeth? So if somebody's watching this and they have a denture, when they go in to get all of this done, are they ever without teeth?
Statistically, I'm not answering your question right. Statistically, 20% of the people that do get dentures don't wear them. 20% don't even wear them, or they chew without them.
Back to your question.
No.
At no time do you go without any teeth.
So they always have something.
They always
How
have
soon
something.
can they eat? Okay, so the procedure's done. Now they have the implants in and whatever you've made them. How soon can they eat?
I've gone to dinner with patients who I've done full arch implants with, particularly when we're traveling. We'll do a
when you're
group
lecturing
dinner.
or teaching
when we're
other
lecturing,
guys.
yeah.
Okay.
So we're still with these people because we'll travel with these people. So we'll go to dinner with them. So I eat with these patients at night, and
right?
And they're fine that night to go ahead and eat.
So you can eat soft food right after the day of the procedure.
Yeah. Oh yeah.
I mean, you don't recommend it.
It depends on the procedure. If you're doing a guided implant procedure, then yeah, you could eat that night.
Let me show you these bottles, Randy. We show these to every patient. These are just some of the options that are available out there.
So denture wear comes in.
Denture wear comes in. This is somebody without any teeth. This is one of our options here, where what we talked about earlier. We put the 2 implants in the corners there, and then we snap that denture into those 2 implants, and now that denture is locked into place.
So no adhesive on that.
No adhesive.
Okay.
And you can take a look.
So what's the next level up?
Next level up is it
Okay.
depends if a patient doesn't have a whole lot of bone, but maybe we can get 4 implants in. A lot of times we'll put the 4 implants in, we'll tie them together with a bar system, and the denture actually locks into that bar. And now everything that they eat or chew on the energy translates into that bar, so they can really chew solid stuff.
And this is still snap in, snap out.
Still snap in,
removable.
snap
And they can
in.
eat an apple, by the way.
They can with that. But if they want to go, if they want to go to non-removable, then you can do that too, and that's what this one is.
Isn't that what everybody wants, by the way?
It's ideally we'd like to see everybody go there. It's because it's the sleekest, it's the smallest. So we have patients who have gagging problems with their dentures. It's too much of a mouthful for them. So if you can get to something like this that's fixed, this does not come in and out. It doesn't snap in and out.
Let me see this. So this is it's in.
It's
and they brush them.
It's screwed in. They
just
treat them like teeth.
And they're strong. They could. How long does something like this possibly last? Ideally.
Indefinitely. Yeah.
Really, maintenance on this
every 6 months. But Randy, I wanted to show you too.
All right.
Here's one last case I was hoping you'd get a chance to see.
So this is dental implants.
Yeah.
So
yeah.
he was wearing a denture.
And by the way, with only 6 implants per arch.
You know, when I think of dental implants, I always think of somebody 80, 90 years old, and this guy looks very young to be wearing a denture.
Any age is too young to be wearing a denture, and that's what's so nice about dental implants is we were able to give him his teeth and his smile back.
So no more. So denture wearers, is there such thing as a happy denture wearer? Because I know a few denture wearers, and they don't complain about anything.
Well, I don't think they're going to tell you, Randy.
Okay, good point, right?
I think people just get used to what they have. They probably forget about the first 3-4 weeks of when they first got their denture and working through the problems. But I think that people just adapt to what they have, and they don't realize what's out there and what's available. And that's our job, is to educate people, to let them know that there are other options and that we can improve their quality of life.
And I think the time when we see it the most is the patients. I wish we could give people dental implants to wear for the weekend, and then come back and decide whether they wanted them.
Like a special try-in. Hey,
yeah,
okay.
That'd be fantastic, because there'd be a lot more happy people out there if we could do that. but when we see this, is every once in a while we'll get cases in where maybe somebody's broken a tooth or something on one of a fixed implant supported bridge. So we have to take that to the lab to fix it. And so we have to take their teeth away from them and put them back in their old denture, and they have to wear that while we repair the bridge. And that's when they really learn, I think, and we hear it from them, that's when they really learn how much they like it. They come back and they've gone from the implants back to their denture, and they forget that what they were tolerating, what they were putting up with. They didn't realize how much they were putting up with before.
Okay, good. Now we're out of time completely, and we'll start with you, Dr. Hall. Final message to the denture wearer that's watching, and they're still afraid. They're worried about pain, they're worried about cost, they're worried about it's going to, that they're too old. Maybe they've been told elsewhere, because you said you get these people all the time, that have been told you don't have enough bone for dental implants. What do you tell them?
I would just like to invite those people in and have them come in and see what actually their options are.
Okay.
And maybe even sit down with them and go over what can be possible, and even take a CT scan and show them that this can be done.
Dr. Roberts?
If they've been told that they can't do implants, get a CT scan. It's easy. It's not as expensive as you might think. We don't send you to the hospital to get the CT scan. It's in the office, and it's quick, and we can look and we can tell you what bone is there. With the better bone that they've come up with, the grafting options, we can get implants in places that maybe you
like not their own bone.
Right. Yeah, we're grafting, building new bone.
Okay.
So we're going to get maybe there's options out there that they didn't have before.
So whether you're 90 or 20, I mean,
it's going to
go in and get
life.
a consult. Okay. Well, thank you so much for coming in. Always a pleasure. And they could see these photos. We didn't get to all the photos, but on your website. And what about consultations? Are they free?
Yeah.
They are free?
Yes, come in and talk to us.
Come in and talk to us.
Yeah.
Well, that's nice. Okay, well, thank you both for coming back on the program.
Okay.
Yeah, thanks, Randy, for having us.
Randy, for having us.
Appreciate it.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you could go to our website at wellnesshour.com and just put in Dr. Hall or Dr. Roberts. You'll find them there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.